Hello everyone, today we'll be talking about Parkinson's, how to complete a physical examination, and the common questions in short case. Some possible stems that the patients may present with are frequent falls, unsteady gait, or tremors. These are the main components of the physical examination. First, complete the usual upper limb neurological examination as according to the stem. Next, elicit Parkinsonism features, rule out Parkinson Plus features, and finally, the offer list. Complete the upper limb neurological examination as per usual. During general inspection, look out for hypomemia. The tone of the patient should be hypertonic with lap pipe rigidity as well as cogwheel rigidity. Cogwheeling is the equivalent of rigidity plus tremors. Do a pronator drift to rule out vascular Parkinsonism as a secondary cause. Check for hyperreflexia and complete the rest of the examination, which is usually normal. Next, the Parkinsonism features. Patients present with classic pale rolling tremors, described to be 4 to 6 Hz, that disappears on movement. Both tremors and rigidity can be accentuated with distraction maneuvers. Also check for bradykinesia, most commonly by asking patient to open and close his hands as fast as possible. Finally, walk the patient and observe his gait. Some characteristics are a stood posture, fascinating gait, hesitation, reduced arm swing, and turning in numbers. Next, we check for Parkinson Plus signs. Check the extraocular eye movements to look for vertical gaze palsy in progressive supranuclear palsy. We should also check for cerebellar signs in multiple system atrophy, as well as apraxia in cortical basal degeneration. Do keep a lookout for facial rings to suggest Wilson's disease as a secondary cause of Parkinsonism. Finally, offer to check patient's handwriting for micrographia, swallowing and speech, abbreviated mental tests for dementia and Lewy body dementia, and postural blood pressure in multiple system atrophy. Next, these are some common questions that may be asked in exams. What are the secondary causes of Parkinsonism? These are mainly vascular Parkinsonism due to a previous stroke, Wilson's disease, drugs, dopamine antagonists such as antipsychotics, infections, and space-occupying lesions. How would you investigate the patient? Idiopathic Parkinson's disease is a clinical diagnosis. However, brain scans can be performed to rule out differential diagnosis. The management of idiopathic Parkinson's disease can be split into non-pharmacological as well as pharmacological treatment. Firstly, patient education on the natural history of the disease, for prevention as well as physiotherapy. For pharmacological treatment, these are the main drug classes: dopamine agonist, dopamine precursor plus dopa decarboxylase inhibitor, most commonly MADOPA, monoamine oxidase inhibitor, COMT inhibitor, NMDA receptor antagonist, and finally anticholinergics for the treatment of tremors. Thank you so much for watching. We hope you found this useful. Do let us know in the comments below if there are any topics you'd like us to cover. Thank you and see you in our next video.